Stephanie Walbornn, and I grew up down here in Florida, so I'm very, very happy to be back down here and working for Rood Riddle. And I just started 3 months ago, so I'm brand new. So all your faces are pretty new to me, but I hope to get to know a lot of you as the breeding season progresses. Today I'm going to be discussing assisted reproductive techniques, so just a couple of different advanced techniques that we can use to breed both stallions and mares. So these techniques allow us to breed subfertile mares and stallions and allow them to produce offspring. They also allow us to produce offspring from those animals that have an untimely death, both mares and stallions. A few of the techniques I'll be discussing tonight include embryo transfer, transvaginal oocyte aspiration, along with the intracytoplasmic sperm injection procedure that goes along with it, uterine tube hydrotubation, and then last but not least, an epididymal sperm harvest procedure. So most of us know about embryo transfer. It's one of the most commonly used advanced reproductive techniques in the equine industry. It's been around for a long time. So just a little overview about embryo transfer. Your mare serves as an embryo donor. She's usually conventionally bred with either fresh cooled, or frozen semen. And then the embryo flush procedure is performed about 7 days post-ovulation. If an embryo is recovered, that embryo is placed into a recipient mare transcervically. And these recipient mares have been chosen for their high fertility, their good temperament, and their natural mothering abilities. They also will carry the foal to term, and usually they will nurse the foal until it is weaned. Embryo transfer is used in performance mares. It's also used in those mares that have uterine or uterine tube pathologies, and also in those mares that can't carry a foal to term due to orthopedic or lameness problems. This procedure also allows us to produce more than one foal per year. So in a breeding season, more than one foal can be produced from a cross from a stallion and a mare. So if there is commercial demand for a specific cross between a mare and a stallion, this procedure does allow us to produce more than one foal. Some disadvantages, of course, are cost. So this is much more intense breeding management than it would be to just breed your mare conventionally and have her foal out herself. And also the cost of the recipient mare. So instead of feeding your donor mare alone, you're also feeding your recipient mare as well. So there's a variable rate of success, and it's very mare dependent. So every mare should be treated as her own embryo transfer candidate. Usually when we flush mares, our recovery rate is about 40 to 55%. Once those embryos are recovered and placed into a recipient mare, we have about a pregnancy rate of 60 to 85%. And after about 30 days, our foaling rate is about 85 to 90%. Moving on from embryo transfer, I'll talk about oocyte aspirations. So in this procedure, ovarian follicles are punctured, scraped, and the follicular fluid and the oocyte is recovered. This procedure can be performed one of two ways, either an ultrasound-guided transvaginal approach or through a flank approach. The ultrasound-guided approach does require more specialized equipment than the flank approach, but it does allow for much better visualization of the ovary and of those follicles on the ovary. And it allows us to aspirate both immature small follicles and also large follicles. With the flank procedure, we don't need as specialized equipment. We usually don't use an ultrasound. We're really doing everything by palpation. But only 1 to 2 follicles, and they have to be large follicles, can be aspirated at a time. So with the immatures, we usually, with the ultrasound-guided transvaginal approach, can aspirate any follicle that we see on the ovary. So it allows us to aspirate a lot more follicles than with our flank approach. A little bit about the procedure. Prior to the procedure being performed, the ovarian activity of the mare is monitored by ultrasound examinations per rectum, and that's really to see if there are sufficient number of follicles and also the size of the follicles, and if there's any ovarian pathology that may make our job a little bit more difficult when we're aspirating them. It's performed with standing sedation, so they don't have to be under general anesthesia. They're just sedated and given analgesics in order to be more comfortable during the procedure. And it is performed in the stocks, both for the safety of the mare and also the veterinarian performing this procedure. The oocytes that are recovered are sent to an ICSI facility, so there are a couple of different facilities around the country that will perform ICSI, and I'll talk about a little bit more about ICSI in the next coming slides, but this procedure can be performed whether your mare is in heat or if she's out of heat, and usually we perform it every 2 weeks, and that just depends on the mare's follicular wave, so how many follicles she actually has on her ovaries and how fast she's actually building those follicles. So let me see if I can pause this really quick just to orient everyone as to what we're looking at, because it kind of looks like a little bit of a blur, but this structure right here, that's the ovary, and what you're going to see is there's going to be a fluid filled, so a dark structure. It's going to be black that's going to come into the screen there, and then from this corner, the left-hand side of the screen, there's going to be a bright white object, and that's actually the needle that's going to be coming into the ovary. You'll see it puncture that follicle, and that fluid is going to go away. So while we're doing this, that needle's going to come in through right there. Oops. So that went a little quickly. Sorry, the laser pointer wasn't working. But so that needle went into that follicle, aspirated that fluid, and you kind of see a lot of jostling going on right now. So what's happening is both the needle is being manipulated and also the ovary is being manipulated. And that's because we actually have to scrape the wall of the follicle in mares in order to acquire those oocytes. Whereas in cattle, it's much easier. Those oocytes are just free floating in the fluid, so really you just have to go in there, aspirate that fluid, and that's about it. What we have to do is scrape that follicle, place more fluid into the follicle to kind of make a very turbulent environment, so we hopefully can dislodge that oocyte and be able to aspirate that up. So what do we do once we have those oocytes? Well, conventional in vitro fertilization in the mare, unfortunately, is very unreliable. So the only way to produce a full in vitro is through ICSI, or intracytoplasmic sperm injection. So the oocytes that are recovered from the mares are shipped usually overnight to a facility that can perform the ICSI procedure. Once those oocytes arrive at the facility, they're placed into maturation media for about 30 hours. And those that do mature are able to be fertilized with one sperm. So only one sperm is necessary per oocyte in order to be fertilized. Those oocytes are then placed back into media and cultured for about 7 to 10 days, or until an embryo is formed. So typically we have some percentages up here that kind of go over what our success rates are. And in our typical, let's say, quarter horse mare, she may have 14 follicles on her ovaries. So when we perform the aspiration procedure, we have about a 50 to 60% oocyte recovery rate. So that's maybe about 7 oocytes that we recover from that mare. Those are sent off and placed into maturation media, and of those, about 60% of them will mature. So maybe about 4 of those will actually mature and be able to be injected with one sperm. Of those that are injected and placed back into media, about 20% of them will form an embryo. So our odds aren't very high, but this does allow usually for one embryo per aspiration procedure, but this can and is very mare variable. So age, mare's fertility, and also stallion fertility, the fertility or the quality of the semen is very important in this. So historically, oocyte aspiration has been reserved for those mares that are older or can't be embryo donors, since there is a lot of management and it's much more expensive than embryo transfer. But it has been used much more frequently now in performance mares, because it does allow for mares to continue to perform. And also with stallions that have poor quality semen or low sperm reserves, this is a procedure that will allow for those to be used when you can't breed those mares conventionally with that semen. Also, like I said, it allows for them to continue on their performance schedules, And season isn't a factor when you're performing oocyte aspirations, meaning that it doesn't have to be breeding season for us to perform this procedure. So mares usually have follicles throughout the year on their ovaries, and these follicles can be aspirated, those oocytes can be harvested, and the same procedure can be performed. Now, if an embryo is formed outside of the breeding season, usually those embryos are vitrified or frozen, and they're saved for the breeding season so that they can be placed into a recipient mare. And then if a mare has an untimely death, the ovaries can actually be harvested, and the oocytes can be used, and the ICSI procedure performed on those in order to perpetuate her genetics. Moving on to uterine tube hydrotubation. So uterine tube, or the oviduct, that's where fertilization occurs. Mares can develop mucus plugs within their uterine tubes that can prevent the oocyte and the sperm from transporting and from meeting one another within the uterine tube. This can either occur unilaterally or bilaterally, and really the cause of this is unknown. So these mucus plugs that are produced within the oviducts, usually an overproduction of mucus, but no one really knows why this happens. And usually a mare will come into us with a history of subfertility. We'll perform a breeding soundness examination, but we won't find anything that we can put known cause to. So really she doesn't have endometritis, she doesn't have uterine fibrosis, she doesn't have anything that we know of that's causing this subfertility. This may be a procedure that we can perform in order to help her out, and so that she can have a foal. So just a couple of pictures here. This technique was actually developed by a Japanese veterinarian. It's the most recent technique that I'm talking about today. So this was developed in 2013. All the other techniques that I talked about have been developed a little bit longer ago. But it is hysteroscopically guided, so there is an endoscope that's placed through the vagina into the cervix and into the uterus. So right here on the right-hand side, we have a picture of the mare cervix. Once the endoscope goes through there, you'll see that there's two areas here. Those are the uterine horns, and in the middle, that's the uterine bifurcation. And there's actually air being insufflated into this uterus in order for you to be able to visualize both of these horns. If there wasn't any air, these endometrial folds would be all collapsed on one another. It would look kind of like a small intestine. This is what the uterine tube papilla actually looks like, and that's at the end of each of these horns here. So I'll show you in the next video what we're actually doing in this procedure is catheterizing this structure here, which leads into the uterine tube, and flushing fluid through so that we can push those mucus plugs out. Oops, sorry. I just wanted to pause this for a second just so we can orient ourselves. This is that uterine tube here. Sorry, it's a little bit difficult to see, but that's the papilla, so the opening into the uterus from the oviduct. And here is a wire catheter that's actually going to be placed into the papilla first, and then the catheter will be fed over that, and we can take a look at that in this video. So the wire guide was placed in, the catheter was placed over the wire guide. That wire guide is actually being removed, and that catheter is seated in, and you like to visualize this at all times so you can see exactly what you're doing. Then fluid will actually be placed into the catheter, about maybe 20 mils of fluid. And sorry, it gets a little blurry there, but it'll come back into focus. But so yeah, fluid is pushed through. It usually takes about 40 to 45 seconds, and then this is performed on the opposite side. So both uterine tube papilla are catheterized and flushed. Rood and Riddle performed a study recently, I think it was about 2 years ago, where they took 15 barren mares. So those were mares that were classified as barren for at least 3 years. So they either didn't have a foal or embryos weren't able to be flushed from them. They performed this procedure bilaterally on all 15 of them, and 11 out of 15 were pregnant or an embryo was recovered from those. So those are pretty good odds. We do, however, need to have more numbers of mares in order to have a more significant difference seen. Some of the advantages are that this procedure can be performed while standing and no surgery is required, and it's also less expensive than a surgical procedure. Disadvantages are that it's somewhat difficult to kind of get the hang of using the endoscope, and we can sometimes get iatrogenic endometritis, so those endoscopes can sometimes seed bacteria into the uterus and cause endometritis. So we're pretty careful about disinfecting those prior to and also after performing this procedure. Last but not least, we'll talk about epididymal sperm harvest. So this is an option for preserving genetics of stallions that have either had an untimely death or have been castrated due to behavioral issues. So the testicles are harvested through a normal castration procedure, and then the epididymides are flushed on both of the testicles, and the sperm are frozen so they can be kept in liquid nitrogen. So one of the really interesting things about this procedure is that immediate processing of the testicles is actually not necessary. So let's say you're in a place where you don't have a reproductive facility close by and something happens, these testicles can be harvested and actually sent overnight on ice to a facility that can perform this. So it doesn't have to be done immediately. And then just to orient ourselves a little bit here, we have a testicle, and then from the testicle, the sperm are produced there. They go into the head of the epididymis, and we have the body of the epididymis and the tail of the epididymis, and from there, the sperm are transported into the ductus deferens, which leads into the urethra. So the area that we're flushing is the tail of the epididymis here, and sperm maturation actually occurs throughout this structure. So it starts in the head and is completed in the tail. So all the sperm that we're flushing are mature sperm and able to fertilize an oocyte. And then this photo here on the left-hand side is of just the tail of the epididymis, and this is the ductus deferens that it attaches to. Also, one thing to note is that this is one tube. It's actually not several tubes together. It's just one very, very highly convoluted tube. I'm just going to pause it really quick. So the ductus deferens here, it's been transected on one end, and the tail of the epididymis has been transected on the opposite end. A tomcat catheter has actually been threaded into this ductus deferens here, and then semen extender will be pushed through and flushed. And if you guys watch down here, you'll see where the sperm-rich fraction will come out, and then you'll notice all these tubules getting a little bit bigger as we flush extender through. So you can kind of see it there. They're getting a little bit bigger, more distended as you push more extender through. And then down here, that's the sperm-rich fraction that we're collecting, and that's what we'll be freezing. So all of the, that photo really gets me every time I see it too. So all the techniques I discussed today do allow for the preservation and propagation of genetics in both mares and stallions, and they are becoming more popular, especially in the sport horse community and the performance horse community, because it does allow for the production of progeny without sacrificing performance. So I thank you very much for your attention, and if you have any questions, I'm happy to take them. I'll also be around after if you have any questions.
You're up and running for collecting semen for export now, is that correct?
Yes, ma'am. Yeah, we have, our Phantom is up, and we are certified by the USDA for export to the European Union, and also for storage for semen for the European Union as well. Yes, ma'am.
How much influence does the recipient mare have on the foal?
Usually not much in the sense of any sort of temperament. However, with our warm blood mares, we do like to get nice big recipients for those mares, or for those foals that are flushed, those embryos that are flushed. So we have nice big uteruses in order to accommodate how big that foal is going to get. Ma'am?
Does it ever occur in the embryo transfer procedure where there are multiple embryos and the embryo remains in the donor mare and the embryos are transferred to the recipient mare, resulting in pregnancy?
Yes, that can definitely happen. Usually prior to the procedure being performed, we'll ultrasound their ovaries and make sure that they have one ovulation. So if they have one ovulation, that doesn't mean they only necessarily have one embryo, but if they have more than one ovulation, we tend to look a little bit harder to make sure that there aren't two embryos in there. So usually, if we only recover one embryo and a mare has ovulated 2 oocytes, what we can do is we'll actually flush her again the next day and see if we can recover anything from that. And if we don't, usually we'll administer prostaglandin in order to get rid of that CL so that mare does not go on and have a full